In 2023, actually, the FDA banned most of the peptides.
Ban peptides?
Humans are not good when things get banned. When things get banned, then humans then turn to the black market to get their peptides, and we're getting them now from China.
Is that where they're coming from?
Most of them, yeah.
Now, have you found that AI maybe has some misconceptions, or patients, maybe when they're sick, they come to you and they've already self-diagnosed themselves?
Learning how to use AI is very important because AI, after all, is what you feed it. I've tested it out. I've had patients provide their data into the AI and it has gotten correct.
Well, they're not medically trained.
You can prompt AI and say,
today. JuliexAI. Today in JuliexAI.
Hi, this is JuliexAI. I'm Julie. I've worked in international relations for over 10 years. I have my MBA in international business, and I'm pursuing my ALM in data science at Harvard. Today, we have a special guest that's changing the way healthcare is delivered. Thank you for joining us, Ivan, from iCare Mobile Medical.
thanks for having me, Julie. This is very exciting. I can't believe I get to be on your first podcast. I'm honored.
You're welcome. Can you please tell us about yourself and iCare?
Yeah. Well, I went to a better school. I went to Yale, physician assistant instead of Harvard, but we'll get past it.
Okay.
So I graduated PA school, and then after that, from Cleveland, Ohio, I moved down to Miami, which is an absolute paradise. And then I started working in a mobile concierge practice where essentially we were delivering mobile healthcare, primary care, urgent care to patients' homes, hotels, etc. But it was more for the affluent. So eventually with time, I kind of went my own way and opened my own company, but tailored more towards the masses so that everyone can sort of afford that VIP concierge service. We opened up during COVID, and as you can imagine, people were just so scared to leave their homes, to go anywhere. So what we did is we brought the medical team to patients' homes. We isolated the sick. We were getting calls, people saying, okay, now that I have COVID, I'm going to jump on an Uber and go to the hospital. Like, no, you're going to get people sick. So stay
Right.
there. We'll come to you. And then we did everything from testing, vaccinations, treatments, oversight. We treated thousands of patients. We had 100% survival rate.
Wow.
We kept 99.8% of the people out of the hospital. So it was quite a very useful service for especially for the time. So it was the wind beneath our sails. And then from there, we obviously, we opened up to just general urgent care services, and we kind of expanded from there. And then we opened up in Orlando. So we're also servicing a lot of the tourists from
Miami, Orlando.
So yeah, Miami, Fort Lauderdale, Boca, Orlando, Daytona Beach. And then a little bit after that, we started doing wound care because, unfortunately with the wounds, it's a lot of elderly people that can't get out of bed. They get these pressure ulcers, etc. So it's a perfect service
Very
for them
smart.
to go to nursing homes, go to people's, and we treat them at home.
Mhm.
These nursing homes have a big problem finding transportation to take the patient 3 times a week to the doctor.
Right.
So having somebody come to the patient's bedside is a blessing, as you can imagine. So it's been great. Patients love us. The service kind of just sells itself. You get treated like LeBron James at home for same price that you'd pay at a traditional urgent care. So it works out great for everybody.
That's excellent. And how long do you spend with each patient typically?
Usually on average, about 45 minutes because it's, low volume. We're not sprinting from patient to patient, and, you're waiting, watching Netflix. You're not waiting in a lobby full of sick other people. And then you get to see the doctor for 10 minutes, and then, you go home. And frankly, when you're sick, the last thing you want to do is kind of just get out of bed and get ready and go to a urgent care or a hospital and wait there for hours in a lobby. So watch Netflix at home, and we'll come treat you there. And it works out great. Everyone's
Speaking
happy.
of Netflix, this reminds me of Royal Pains.
It's a funny story.
Yes.
Okay. So when I was in Cleveland, I was at a radio. I was listening to the radio, and it was one of those, like, caller number 9 gets to win something. I didn't even hear what it was. So I called. I was caller number 9. And then I got a beach bag in Cleveland. I got a beach bag with the beach toys. I'm like, this is funny. a little foreshadow, and then season 1 of Royal Pains, which I hadn't even heard of. So, I watched it. I'm like, wow, this is really cool. But I didn't even know that kind of medicine existed. So I'm like, oh.
Oh my gosh.
So then I went to school, I graduated, I got on Indeed to see what jobs are available. And one of the first postings was a concierge medicine. I'm like, oh my God, that's like Royal Pains.
It is.
So I
yes.
applied and I got the job.
Amazing.
So it kind of sparked from Royal Pains.
It was
believe
meant
or
to
not.
be.
Yeah,
That was
it's
your
kinda-
destiny, the
It's kind of
beach
funny how
bag.
things work. Yeah, like the
Yes.
first domino was being caller number 9 at a radio station.
Well, Miami is the winter Hamptons.
Yeah, it's the perfect location for it. We
Yes.
get a lot of tourists and a lot of people from, international international tourism that don't have U.S. health insurance. So for them to go to the hospital, it would, without U.S. insurance, would cost them an arm and a leg. So
That's a great point.
Being
Do you speak
treated at
other
home.
languages?
I speak Spanish, a little bit of Italian and Albanian, but my medical providers speak a lot of Spanish, so we get a lot of Spanish tourists. But we have, online services where you call a medical interpreter and they speak every language in the world. So, language has never been a barrier, quite frankly.
Because of AI?
I think AI will be next. Right now, it's actually medically trained humans, but I wouldn't be
Oh.
surprised if the next thing is actually AI. I think that's very, very close, frankly.
I think that would probably save money and maybe time.
It would save money, to the clinic, and time probably would be a little bit more instantaneous. It's not that the service that we use is any, a huge delay, but sometimes it can take a little bit of time, especially for a less common language.
Right.
Versus with AI, it would be quite instantaneous. And, we've kind of tested it with those, what is it, Apple AI that have their translating app.
Yes,
You
yes.
just put
I
like a
put them
headphone
in
on.
my
Yeah,
earbuds.
kind of tested
Yes.
it a little bit like that.
For sure.
Yeah. So I think AI is quite interesting in many aspects of healthcare. I think it's quite exciting. in my
What else do
opinion.
you use in your office or when you're on the road?
So right now we're working on integrating it with our note taking. One of the worst parts of healthcare is just all the
Right.
note taking and charting, and a lot of
I imagine.
doctors, medical providers are typically doing it after they leave home,
Ugh,
or you're going to be one of those guys that's typing while the patient is speaking, which everybody hates too.
right. Which
There's
being
just no great
VIP,
solution.
concierge.
Exactly. So this new system that's integrated automatically into our EMR, you just wear a little microphone and it takes the notes for you and it uploads it turns it into a template and uploads it into your charts automatically.
Fabulous.
Yeah.
I need that in school.
I know. I wish this would have came out sooner because it just
Yes.
saves so much time. It's one of the most aggravating parts of healthcare. It's just all the note taking. Ask any medical provider.
Mm-hmm.
Yeah. So that's what we're integrating. One of the challenges in healthcare and AI is HIPAA compliance.
Yes.
Not most AIs are not HIPAA compliant as it stands. I'm sure that's going to change. And it all
I'm
has to
sure.
do with how the data is stored.
It's probably on all those data centers.
Exactly. Well, yeah. So, as they become more HIPAA or medical provider friendly,
Mhm.
and there are a couple already, but what I use it for example, if I'm reviewing, sometimes for wound care, for example, you're following up the patient for like 8 months and there's so many visits. And for me to skim through all those notes to see if we did this or did do this, or does the patient have a history of this, takes a lot of time. So I upload the entire chart on the EMR and then I just get to ask questions. It's like having
like
an
that.
expert specifically about
Like a search
patients.
search
Yeah.
tool.
It just makes it so
That makes sense.
instantaneously.
And it makes your job easier. You can treat the patient better.
Tremendously, yeah, because then I can focus on the stuff that I love, which is providing healthcare rather than documentation, right?
That's why you went to school.
Yeah, well, and that's why we have big brains to help us. A lot of people are kind of scared of AI, but I find it quite fascinating personally. I'm more on the friendly zone.
That's why we're here.
Yeah.
To help make AI understandable.
That's why I was excited when you called me, because I'm like, I
Yes.
think people need to see the positives of AI.
Yes.
It's like any tool, right? You can use it for good, you can use it for bad. It just all depends on the person using it. And
Exactly. We have to embrace it.
yeah,
So
can't
we're
fight
not
it.
afraid. No, it's here.
it's
It's
here.
not
You can't
leaving.
fight it. Now we've opened
No.
Pandora's box.
Oh, yes.
So now what are we going to do about it?
Right.
And we can either, let the times pass us by and be left in the dust, or learn how to use it and,
That's right.
use it to your advantage.
It's here.
Yeah.
We're embracing it. We're going to make it HIPAA compliant.
It's a
We're
must.
going.
It's a must.
Now, with wound care, do you take pictures?
Excellent question. So yeah, one of the things that there's already apps that exist where it takes a picture of the wound and it analyzes even the depth, the color, the changes, and it keeps track. and it tells you, hey, the wound has decreased by this percentage over time. It's fascinating because it avoids a lot of human error. Because how do you measure with a ruler an irregular shape? It's very difficult,
You
right?
have to like draw on it or
It's very
something. Take a
difficult, and it
picture.
takes time, you know?
Yeah.
So AI, you just snap a photo of it, and it just documents everything, and it just uploads everything to your
And then you
patient's
have that
chart.
picture.
It's incredible, yeah. I'm telling you, AI is gonna, I think it's gonna do far more good into our daily lives than people realize.
Now, have you found that AI maybe has some misconceptions, or patients maybe when they're sick, they come to you and they've already self-diagnosed themselves? So it slows down you
Yeah.
treating them?
Yeah, so learning how to use AI is very important because
Mhm.
AI, after all, is what you feed it, it'll regurgitate it back to you, right? So
Yes.
if you feed it crap, you're gonna get crap out.
True.
So
I think I've heard that phrase in other
yeah, so
phrases.
knowing, knowing what information to provide it is kind of helpful. Like I've tested it out. I've had patients provide their data into the AI and it thinks it's something else, and then I have taken their data and provided to the AI, and it has gotten the correct
Well,
diagnosis.
they're not medically trained.
Correct.
So they don't know.
Correct, exactly.
They're just trying their best.
But
But they're
there's
scared.
but if you had the if the patient had the training, you
Right.
can prompt AI and say, you are a doctor,
Mhm.
ask me all the medical questions necessary to get me the diagnosis, and it'll do a very good job at that point.
That's a great point.
So learning how to prompt AI is kind of one of the very first preliminary steps into integrating AI into our lives.
I think that is a great point, that we need to learn how to prompt AI and to integrate it into our daily life so it makes your life less frustrating and easier on the person using it.
And I think you'll be more accepting of the changes
Mhm.
once you see how helpful it can be in your daily lives or your tasks or et cetera. The other thing that we're using it, it's not medically related, but it is, part of my company, is we've integrated into our accounting system.
Oh,
So, doing like data projections and finding minutia, it just takes a lot of calculations and a lot of digging, right? It's not very simple because you're putting all these systems together to talk to one another, and it's very messy. With AI, you can have it integrated into all your systems, money coming in, money coming out. And now when I have an accounting question, for example, it's very simple. I just ask the AI and it gives me the answer within minutes. It's
right.
incredible versus, that would probably take hours to days before that.
Right. So it puts in the codes and whatever else you do in the medical world.
Yeah. And again, setting it up is very important, learning how to set it up. So,
So you need a human for that.
You need a human for that, for sure.
Mhm.
And a trained human on top of that,
Right.
right? So you have to know kind of what you're doing. But it's no different. Remember when computers first came out, we needed some training on how to use a computer.
Exactly.
And now, my grandma is on her iPhone scrolling through TikTok, sharing videos with me. Like
I love that.
That's a crazy concept to think about just 20 years ago where we've come.
And she remembers, I'm sure, black and white TVs.
Yeah, or not having it.
Or not having it. So that's great.
Yeah.
It's amazing.
So, it takes training like anything else. But
Right.
once you learn how to use it, then I think people will become more and more accepting.
Now, have you incorporated any longevity or peptides into your business?
So it's funny you ask because it's a very hot topic right now. Is the
It
peptides,
is.
right?
Yes.
And longevity medicine, which I'm a huge fan of, and I try to be a good patient to myself.
Yeah.
Longevity medicine, which
Mhm.
doctors are very terrible patients, but I'm trying to change that. But anyway, so in 2023, actually, the FDA banned most of the peptides. So as it stands, actually,
Ban peptides?
banned peptides because there's limited research, they said.
What?
And there's a strong argument for both sides of that argument, right? There's not a ton of human data, there's a ton of animal data.
So the clinics that are popping up and all the web sites, everything that we're getting that they're saying take the peptides?
For starters, the word peptide is very broad. There's a lot of
Okay.
things that constitute as peptides. For example, semaglutide, Ozempic, Mounjaro, the GLPs, those are also peptides, but they also fall under the category of drugs.
But those are FDA.
Those are
cleared.
FDA, exactly.
Okay.
So there are peptides that are in research phase. There are peptides that are drug FDA approved.
Okay.
What the FDA has banned are the non-FDA approved ones that are still being sold as clinical research.
Oh, okay.
So like BPC 157, that's a very common one for like anti-inflammatory. TB 500, they have all these, they call them stacks. Essentially, they kind of lump 2 or 3 different peptides together
Yes,
that
yes.
kind of have a specific outcome.
I've seen the letters and names, letters and numbers.
It's all it's all
And
codes.
you just inject yourself. You just maybe put it into a chat bot. What do I need?
Right. So a lot
This
of
is
people
how
are
I'm
using
feeling.
a lot of people are using AI and saying, hypothetically, if I was a
Yes.
doctor, how would I take this peptide? And then
I've actually looked into it, and it
Yeah.
says not for human use, only for animals. Is that
Exactly.
right?
Exactly. Again, most of them. But there's an upcoming hearing in July, I believe, where they're trying to reverse that ban.
Oh,
So, humans are not good when things get banned, in history
True.
speaking, right? So when things get banned, then humans then turn to the black market, the gray market to get their peptides, and we're getting them now from China. And
is that where they're coming from?
most of them, yeah.
Not
Yes,
from
it is.
India, Mexico.
I mean, I'm sure there's probably some, but I think probably the biggest supplier is probably from China, which is not necessarily a bad thing.
Oh,
But you have to be careful. You have to know the source, and it very much behoove you to get it independently tested.
how would
somewhere
we
along
know
that.
that? How could
Well,
we get it
that's the problem.
tested?
So that's the problem, and that's the philosophy. That's the theory behind. Okay, we need to reverse this ban because it's going to be much less harmful if we have some form of control
Mhm.
and we force these compounding pharmacies to do the testing. Then that way, at least we know that people are getting the right stuff, the right dosing. Because it's not even just it's the purity. Are you actually getting the right drug?
Right.
How much of that drug is in it? It's kind of like supplements. They're not regulated.
That's what I was just thinking of.
Yeah.
Vitamins.
Vitamins are not very much
Yes.
regulated. Sometimes they do their own sort of independent testings,
Mm-hmm.
but at the end of the day, how sure are you? There's
We try to go with a better brand, maybe a glass bottle.
right. A trusted brand, right?
Yes, trusted
but,
brand.
how many times have we been disappointed in the past by trusted brands ended up being not trusted after all? Or those brands get bought out by a bigger company.
It
and then
happens.
It
Money.
happens all the time.
Money. It's always money.
So yeah, so there's a strong argument to be made that peptides should be the bans should be reversed so that at least there's some form of regulation so that people are getting A, prescribed by a doctor, and B, they're getting the right stuff, the right amount, and the right purity.
That is breaking news. I never heard that
Yeah, a lot of people
before.
don't know that.
No.
And I've seen some doctors prescribe it. I'm not sure that
They do?
Yeah, I'm not sure that they know, or pharmacies compound it. It's one of those things that the patient's not going to get in trouble for using it, but the doctor.
No,
and
but
the
could we
lab-
have side effects in our body?
Well, you can have side effects from even if it's pure. Side effects exist all the
And
time.
I guess we wouldn't know. We've never tried
Sure.
it.
Exactly.
And if it's coming from China, or...
So the purity
We
matters,
don't know.
right? The purity matters. We're not sure whether you're getting clean stuff because you're injecting it in your body.
yeah, it
So
could
should
be, maybe it's clean one
should be-
time and then it comes from a different
right.
source.
That's
The
right.
next time you wouldn't know.
That's right. So generally speaking, I'm not a fan of a ton of regulations,
Right.
but this is one of those scenarios where regulations are actually necessary.
I agree with that. I'm not a fan of complete
Heavy regulations are.
heavy regulations,
Stunt.
but I could understand it for health and purity.
And so let's think of it about this way. We have animal studies and they sound pretty promising with peptides specifically, but we don't have a ton, if any, in human studies, human research. So now if the animal studies look so promising and we know that it takes a long time for human trials to come out and they're very expensive, very costly, and very time consuming. So do we miss out on a very good opportunity currently just because we don't have those very long studies with humans? There's an argument to be made for both sides. Like, maybe
Well, has Europe or another country tested in humans?
no, because this is somewhat kind of, again, peptides are very broad.
Yes.
So some, of
I didn't
course,
know
have.
that. I didn't know
So some,
that
of
Vic
course-
would be a peptide.
Yeah, peptide just means it's made by amino acids.
Oh,
But then that
okay.
that chain of amino acids can be tested and tested and tested, and then it gets the brand name of drug and FDA approved, et cetera, right? So, and then people always ask, first question is, what are peptides? What do they do? And it's like asking, what are drugs? What do they do? Right? It depends which one you take, and you get a different outcome. Same thing for peptides. Different peptides have different results, different outcomes, different side effects. They should be mixed or not mixed with one another. They should not be mixed with certain medications that you have. So
That's a great point.
so there should be some medical oversight. AI is great, but it's not perfect. So
Right.
there's at least yet.
Right.
We have to be careful. And it's not that it's AI's fault. It's just, again, the person using it, is it feeding the right information to get the accurate
Right. We all need
results?
to remember that.
Yeah.
The prompts are very important.
So having training in the prompts and having that medical background to know to feed the right prompts is very important. So you have to be careful doing research on your own. And, I always encourage people to do research on your own, but you got to keep that in the back of your mind that AI is kind of almost a little bit trained to please you.
Hmm.
A lot of people have probably noticed that. Like anytime you
I
say
think
something
that's why we
incorrectly-
like using it.
well, I think you're right. There's definitely something to it. But again, these peptides should have some medical provider oversight because they do have side effects, like I said, and they should not everyone can take every peptide. Just no different than any drug, right?
Right.
If we say everyone can just take any drug they like, that seems pretty silly thing to say.
Completely.
Again, no different than peptides.
Very interesting.
I know we kind of diverged from AI.
We did. We did. We could roll it back a little bit.
Okay, so speaking of research and
Yes.
AI, I think it's fascinating. I think AI is going to have a big hand in research, in clinical research.
Okay. In what way?
Not only just logistics, right? Putting together the studies, analyzing the data, which can be very promptly, and it would take a human maybe months.
Mhm.
AI can do that instantaneously, but also one of the hardest things about research, one of the hardest speed bump is we have an overabundance of information as it stands. There's just so much data out there.
Mhm.
We went from having no data to having an overabundance of data. And no one is an expert in all fields of research. There are certain groups that have read a ton of research in their specific field, but not on every other field. So having an entity like an AI that can do all that, it can be an expert in research in all of the fields, and you combine that information together, think about how much we can accomplish.
Go much faster for sure.
Extremely faster.
Yes.
But of course, the FDA is still going to get on the way.
But you need a human to guide it.
Of
So we're not
course.
taking away human jobs.
Yes.
You still need the knowledge, the education, the background.
I think most of us agree that as it stands, AI is going to be more an adjunct
Yes.
to our daily jobs more so than a huge. Some jobs probably will get replaced, but
You don't need as many humans.
well again, how many jobs have been created by the creation of computers, and how many jobs were eliminated by the creation of computers. So jobs will switch and divert to other fields.
Exactly.
Things
We
kind of-
change, we adapt.
We adapt. Yeah,
We're very adaptable.
right. The coal industry is almost out of business. Is that a good thing or a bad thing? It is what it is, right? We learn how to adapt. Those people that worked in coal mines now work in other fields.
It's healthier for them as well.
Drastically.
Yes. So
Drastically.
that was a positive.
Yeah. This fear against AI and taking over the world, there's some science fiction to it. It's kind of exciting to think about, but
It is.
but I think the possibilities of the goodness that can come from it, and I think you're going to see that a ton of research is going to come out much faster as a result of AI.
Mm.
New drugs for cancers and for things that we did not know how to even look for before.
It's exciting.
I think so. I think
very
we're very
exciting.
exciting. I think like millennials are in a very exciting generation.
Yeah.
We've been through so much trauma.
Yeah. Well,
We've seen,
they went through COVID and
Yeah.
there's so much going on. We're on the edge. We're on a breaking
Yeah.
point.
I think so too. Cryptocurrency and AI and
Yeah.
quantum computing, that's going to be crazy too. And then you mix in quantum computing with AI, then, that's going to,
That's what's happening.
that's going to be interesting.
So looking back,
Uh-huh.
in 5 years from now, what would you say that we're wasting our money on or time that maybe might have been more of a marketing ploy that wasn't beneficial to us?
Let me think. What are we wasting our time on?
Time, money that we're doing as humans that in 5 years, we're going to look back and say, what was I thinking? That
Yeah,
was
well,
silly. That was ridiculous.
There's a lot of that in every field, even in healthcare, like smoking.
Smoking.
What was I thinking? Smoking,
Vaping.
One of the things that we're wasting on our time on is fighting AI rather than spending that time learning how to use AI and integrating into our systems. I think one of the AI is advancing very fast. What's going to be the bottleneck is how fast humans integrate it into their daily lives.
Mhm.
For example, integrating AI into my own company is a lot more complicated than it sounds. A lot of it due to regulations, again, because of HIPAA.
So the government is working a lot slower than AI.
Are we surprised?
No, but just to clarify.
Humans in general, but yeah, the larger the entity, the slower things move then, the glacial pace.
Right.
But healthcare in general just is so far back in technology, it would blow your mind. Like I request medical records and people still fax me results. Fax.
You know what? I still have to fax documents to the government, do certain things
Right.
with fax.
How's that a
I
thing?
just spent like $50 faxing.
Why are
I
we
don't
still
have a fax
Why
machine.
are we still Yeah. Why are we still faxing? It's snail mail.
Exactly.
Again, humans, I think, are probably the biggest bottleneck. Regulations are another big bottleneck. So I think we're going to look back 5 years from now and say, hey, we could have been further and made our jobs easier had we just sort of embraced it a little faster, a little wiser
Well, thank goodness for JuliexAI.
to enlighten us.
Yes, we're going to be more adaptable and we're going to understand AI.
Did you create that logo using AI?
I did.
See?
I did. And I added your logo.
I know.
Yes.
It's very cool.
Thank
you know, we use it sometimes for social media too, for advertising. I just give it the prompts and a photo of myself and it creates it. And it's just, you know, what took me hours before with Photoshop, etc., takes me a second now
Yes.
for free.
For free.
Yeah.
Well, we pay monthly.
True.
Yes.
A nominal fee, I'll say that.
Nominal fee.
But
Exactly.
there's free versions, you know, to even to ChatGPT. So yeah,
Yeah.
if you really were not
We
into
barely use
spending
it.
$20
Yeah.
an hour, there's still a free version. But yeah, for a nominal fee, I mean, it can be quite drastic results. Oh, look, it looks beautiful.
I agree. So, how do patients get in touch with iCare? How would they make appointments with you?
So another good point on AI. What we're noticing, we keep track of how patients find us, right? So because it's a good marketing tool to know how you're becoming visible to patients. And more, the data is changing that people are finding us on AI. People are just going on ChatGPT or whatever and saying, hey, I need a mobile doctor, etc. And then based on the location, AI recommends us and gives us our website, our phone number, and then patients call us. When we got the first couple of calls, it was very exciting. You know, we asked patients, how did you find us? Like, hey, you showed up on ChatGPT.
Oh, I have another question. Since you're VIP concierge and we're in Miami, you and I are in Miami, but you have locations everywhere. Has anyone ever sent a chopper to like their yacht, or you've flown to like Tampa, Orlando
To pick me up?
Yeah.
No, I have I've been offered
Okay.
to go to other countries
Oh.
and provide services there, but I'm like,
course,
"Ah,
I'm
you
not
know, it
surprised."
sounds very tempting, but I'm not licensed in those other countries, so I can't exactly. But I
But
was
were
like,
you
"No."
offshore maybe? So it didn't count.
I was like, you know,
International
call me. I
waters.
can give advice to the local doctor there, or I can oversee it, and so that you feel comfortable.
Well, you are trusted.
Yeah, well, thank you. But you know, I've been into very, very cool places, yachts, a lot of yachts, private jets,
Private jets, yes.
hotels, a lot of
Hotels.
hotels, people's homes. But you know, we also take care of a lot of poor patients too. So we go to nursing homes, we go to
It's needed.
little condos,
Needed,
and
yes.
people that have a hard time getting to even grocery shop. So I see,
Shut-ins.
I see quite a variety of patient base, but everybody gets treated exactly the same. So that's kind of what I love doing.
That's because you're focused. You're dedicated on one patient, which is nice.
Empathetic. I care about the results. You know, we have, if you Google us, we have only 5-star reviews, because, you know, I come up with a background of service industry and, you know, carry that into healthcare, and you get concierge medicine. But, you know, every one of our medical providers that goes out there, you know, is a mini representation of me, and I treat all my patients like their family. So that has to carry. I'm very flexible, but I have a hard line with the quality of care that we provide.
I truly believe that. I think all of us today believe that. We feel your empathy.
You know, I try to make some this just shows to human nature. I try to create some educational content, you know, learning how to understand your labs, what to do, the red flags, etc. And they barely get any views. And then I say something funny or silly or maybe curse a little bit, and then things go viral. It's very
Interesting.
It's very frustrating.
You're like, I want to educate you.
Yeah. So, you know, I mix it up.
Well, we educated on peptides today.
Yeah. I had a present. Yeah, a lot of people don't know that they're still very much illegal. Most of them.
How would we
most of them-
know?
And it was a recent change, you know, 2023, so it wasn't too long ago. But it hasn't been since recently that there's been such a big hype about peptides. Why is there a big hype about peptides? Does anybody know? I don't know.
I don't know.
I think
It's the new
it comes,
trend.
I think it comes from a hunger from traditional medicine. I think there's a little bit of a mistrust in the healthcare industry. I think there's a lot of mistrust in
A
the
lot of
healthcare industry,
mistrust. We want longevity. We want to stay young.
which is great.
and
I
beautiful.
love the people that we want longevity, because one of the hardest things in treating a patient is treating a patient that doesn't want to get better. it's almost impossible. So I love when I show up and the patient's like, I want to get better. I want to do this. I want to live longer. I want to be more youthful. I'm like, great. We have so many things that we could work on.
Do you have patients when you feel like they've given up?
A lot.
That's difficult.
Especially so I think out of all the things that I do, I think wound care has probably been one of the most rewarding field because these are people that have been suffering for so long and they've kind of given up on them getting better. So once you heal them of their chronic wounds and they get their lives back and they get to save their limbs, you kind of see a completely different person.
Now, how long does it take to heal a wound?
Oh man, I have had patients, I've had these wounds, these like big open sores for years. And they finally call us and we do advanced treatment. You have to keep in mind that the body's designed to heal itself.
Right.
So one of the most useful tools is figuring out why the body's not healing. And then you fix that. And then lo and behold, the body kind of does a lot of the healing on its own. For example, patient that might be diabetic, that wound is, severely diabetic. That wound will probably never heal no matter what you do to it.
Never?
You clean it. Yeah, because it really stops the healing process.
What about hyperbaric chamber?
If you don't heal the patient, if you don't fix the patient, that the problem that caused the wound in the first place, it's extremely difficult to heal that wound. So, back to the diabetic patient, if you want to heal the wound, you first have to get control of their diabetes. So better medication control, better diet.
Okay.
And then you do things like there's advanced there's conservative treatments, advanced treatments. There's a ton of things that you can do to the wound. But the most important first step is treating the patient, treating the cause that caused it in the first place.
Like the inside of the patient.
Yeah.
Treat from the inside out.
Again, the body's designed to heal itself.
Right.
So we have to get it back to that state.
So that makes sense.
Yeah.
Which
hyperbaric chamber on a super diabetic patient, it could only help, but you're going to see minimal results, costs money, takes time to get to back and forth the office. And then after, a month or two, the patient doesn't see any drastic results. They give up.
I could see that.
Yeah.
You get frustrated.
Absolutely. You give up. Frustrated.
Give up. You're like, no, not frustrated. They give up.
They genuinely just give up. Yeah. Due to frustration, of course, but it's exhausting. Think about
expensive, exhausting.
Imagine if you had to go to your doctor 3 times a week.
That's a job.
Yeah, it's a job. And you are bedbound on top of that. So just going to the bathroom is a chore. Now you got some jerk telling you got to do it 3 times a day.
No.
You got to drive 45 minutes in Miami traffic.
Oh my gosh.
And then I got to put you in a hyperbaric chamber. You're like, all right, I'll give it a try for a month. And then after that, you're like, I'm done. But you take,
But you try.
But of course, always. But you do things like, you get better medication control, educate them on their diet. It's probably the easiest thing you can do to heal a wound.
So it sounds like to me that's an advantage of someone going to iCare versus going the traditional route to doctor.
Yeah, the advantage is obviously the time it saves you, but it's also compliance. So with wounds, compliance, for example, is very important because you have to show up regularly. Someone needs to keep an eye on it to make sure that it doesn't get infected, the treatment is working. And like I said, when you have to go 3 times a week to a clinic, it gets exhausting. So people find excuses, or really they have plenty of excuses why not to go, and they skip treatments.
Right, the drive, waiting in the waiting room.
And then as a result, lack of compliance, and then you get poor results.
Maybe not the one-on-one attention.
Yeah.
I know I've been to doctors' offices. They do not have a machine on them recording me.
Well,
they're on their laptop.
Again,
and it feels like they're distracted
because they have to do so much charting. So hopefully
that's
with
what
AI,
it's called. Yes.
Well, hopefully with AI that'll change. I think with AI that'll change dramatically. I think doctors are going to be pretty prone. We're still a little hesitant because it's not perfect, but neither is a human.
What is?
Neither is a human. Right. Or autonomous cars, for example.
My gosh.
They have far less accidents than humans do.
But we see the Waymo always stuck in the lane.
But we show that one example.
Right.
And then, that becomes the poster child of all autonomous vehicles.
I haven't taken it yet. Have you?
No.
I do want to.
I just haven't had the need to. It's
but
not
I want
to.
I do want to. I'm not afraid.
Yeah. I think it's pretty cool.
I'm not afraid
I love
at all.
technology.
I do.
I always have the latest technology.
I have the app. I'm ready to take it.
Yeah. Speaking of technology, my wife is pregnant, as you know.
Yay.
So at the office, I have an ultrasound machine that was purchased for $45,000.
Of course you do.
Giant.
Yes.
It's like almost the size of a fridge. And then now I have an ultrasound that's about this big that I bought for $5,000. Almost exact quality, and I plug it into my phone.
Oh my gosh.
So now when we're bored, we just look at ultrasounds of our baby at home
That is
in
so
our own bed.
sweet.
Yeah. But again, advancements in technology. It's very cool.
That's amazing.
And then there's another company now.
And you could take that with you
In my
on the
pocket.
road.
Yeah. I take it like when I travel. No reason, because I'm,
But you never know.
I'm a tech junkie.
But are there any other devices that you could do that
well,
with your
look,
phone?
she feels a weird pain.
Mhm.
Am I going to sit and be stressed about it, or do a quick ultrasound and figure out, no, everything looks okay?
Everything's fine.
Right. So
Yeah.
now there's another company that has these portable ultrasounds, but they have infused it with AI,
Mhm.
and all you're doing is you're holding it to over wherever you need to look for, and AI will do the diagnosis, will interpret the data for you.
Like for what? Like broken bones or what?
It's more for broken bones are more for X-ray. AI is
Oh.
more for soft tissue. So like think about
Sorry.
like you go to the hospital,
Yes.
you were in a car accident,
Okay.
and you need to figure out very, very quickly if you have an internal bleeding.
Oh,
right?
Okay.
It's very easy to miss. So it requires a lot of training to train somebody with an ultrasound tech to look at all the right spots, etc.
Hmm.
Now with AI, that training becomes so much easier, and things get missed so much less frequently because you're catching things on the spot as it happens.
So is that something you're going to incorporate?
We do not. Yes, I would love to. Mostly just because it's fun
Yes.
to have that capability. But this is more like hospital based. But, actually, I take that back, because we do see people with like blood clots in their leg. They have
Yes.
redness and swelling. You're not sure whether it's just an infection. Is it a blood clot? You do a quick ultrasound and you find right on the spot whether the patient has a DVT or not.
Well, you already have the ultrasound
Right.
attachment.
Now I just got to buy more of
Now you need the other one too.
That's right. The
Anything
AI
else?
incorporation.
That you could attach to your phone so easily, or
Yeah.
send like signals.
So yes, a ton actually. There's a stethoscope that I have that attaches to my phone,
Okay.
an otoscope, so I can, when
Oh yeah, the ears.
you can look at the ears with the
Mhm.
camera, and you can actually show the patient and educate
You can?
them.
So they can see
I
what-
love to educate
what's in their ears.
patients, and you tell them, because they're like, well, my pain hurts, my ear hurts.
Mhm.
Clearly there must be an ear infection. So that I show them, I'm like, look, you see how this side looks identical to the other side, or vice versa. Or like, you see how it's really red and swollen, it's an infection, we got to get some antibiotics. So to be able to, patients love to be educated, contrary to belief.
I think us as humans, when we're educated,
Yeah.
knowledge is power,
Mhm.
right? So when we know, then we're not stressed. Just
Right.
like you with the baby. When
Right.
you know, now you're not thinking inside your
Exactly.
head. You don't have the anxiety.
More information is better than no information,
Mhm.
in my opinion. Of course, knowing how to interpret that is important, but that's why you have the medical provider there.
Now, does that help with your retention?
Yes, because you become a trusted brand, a trusted doctor, somebody that people feel that they're not being rushed. They're not just another number. You hear that a lot in healthcare. It feels a little bit like an assembly line. Next,
Mhm.
next, and you have little connection with your doctor. And that's not to the fault of the doctor, by the
No,
way.
no.
It's the system, the
the
way that it's
system.
designed. It has a ton of flaws.
Mhm.
That's a subject for another
Yes.
very long podcast of what the flaws are in our system. But the point is that we are trying our best in a very flawed system. And we have a ton of patients to get through. We have a very limited amount of time. We have to cut through the chitter chatter. And it feels robotic to the patient. With concierge medicine, things are a little bit more slowed down at a slower pace. You have that time for the one-on-one. You have time to educate the patients, and that builds trust. That builds a reputation that, hey, this person will take their time to listen to what I have to say and explain to me. People say, or I guess doctors say that, oh, my patients never take their medications. They hate taking. Nobody loves to take medications, don't get
Right.
me wrong. But if you educate them why they need that medication, why we don't have any other better options,
Mhm.
you're going to see far higher compliance rates.
And then they heal, and then they tell their friends.
Exactly.
So now you have word of mouth.
Next thing you know, you got 5 stars all around. Yeah, that's how it works.
That's excellent.
Yeah. It's a great service. I think most people, once they try mobile concierge medicine, whatever you want to call it, it's hard for them to go back to the traditional brick and mortar.
So is your business 24/7, 365?
It used to be 24/7. Now we've cut it down to just 7 a.m. to midnight.
Okay.
We didn't get as many calls after midnight as you think, because most people are making, specifically for like urgent care stuff, right?
Mhm.
Like you have an ear infection or a tummy ache or respiratory infection, you're going to decide to go to the doctor either first thing in the morning or right before you go to bed.
Mm.
You're not going to wake up at 3 a.m. and decide, I should go to the doctor now. It rarely happens that way.
Right.
So we figured, okay, I don't think we need to kind of torture our staff at 3 a.m. And we decided to shut down during those times.
Okay.
It used to be 24/7 during COVID. I think that was pretty important though.
That would make sense.
Yeah, because we needed to do some consistent monitoring.
It was a pandemic.
It was crazy.
Yes.
It was nuts.
We remember, but would like to forget.
Yeah.
Yes.
Yeah, that was very interesting. Between like all the misinformation that we had to go through, the constant changing of information that we had to go through, it was chaos.
At the beginning, they
was
told
chaos.
us we don't need masks. Do you remember that?
I remember everything. I was there.
But they were wearing
It
them.
was trauma. Yeah.
And then all of a sudden, we all need masks.
And then we needed 2 masks.
Yeah.
And then 1 mask.
Very interesting.
And then you needed a hazmat suit. Yeah, but this is why there's such a mistrust in the healthcare community,
Right.
with the healthcare community, but look, to our defense, information changes and we have to change with it.
Yes.
So
Very true.
just because things are changing, we can't just like, well, I said this, I should not change my word. As
Right.
more information comes out, that's what humans should be doing. We change with more data.
Exactly.
And the other thing is that the virus itself was also very changing.
Mhm.
And, people, when they're arguing with one another, were using talking points from old COVID versus new COVID to prove their point. These were almost completely 2 different diseases. When we first started, it was very scary.
Right.
We didn't have any treatments. We didn't know how to treat it. We didn't know where it came from, how it was how it was caught. So we had to do a lot of guessing.
Mhm.
And a lot of that guessing ended up being wrong. But it wasn't a conspiracy.
No,
We
no.
were just guessing,
Right.
to the best of our knowledge based with other diseases. But the other problem with COVID was that a lot of, I think the medical community, because there was so much noise, I think the medical community truly didn't have a voice. Again, we had 100% survival rate. And I didn't do anything special other than treat it no different than a severe flu. So we used some common sense,
Mhm.
cut out the noise. We said, okay, this is a disease that causes a ton of inflammation. So therefore, anti-inflammatories should be helpful. I tested it on myself. I was patient number 1. I gave myself a high dose of steroids and it brought me back from the dead within like 4 hours. I'm like, okay, this will be the new protocol for all patients
Wow.
going forward. Yeah,
I bet more people wish they knew you.
I couldn't.
Right.
And honestly, a lot of it was banned too. And I
Oh.
tried to post information on social media about COVID. It got taken down. And I know why, because there was so much misinformation.
So it was censored?
It was censored, yeah. But again, somewhat to their defense, because there's so much white noise, AI would
Mhm.
know what to censor, or I guess, was it AI back then? It was probably humans, maybe some AI.
I'm sure
Who
AI
knows?
was in the background
Sure,
with
exactly.
like keywords.
But, it's there's no clean way to know who to censor, what not to censor. So they kind of enacted some blanket censoring all
my God.
around.
That's crazy.
But, good information and bad information wasn't getting out as a result of it. It got out to my patients because they called me,
hmm
but a lot more lives could have potentially been saved.
What do you think contributed most to your success?
As a business owner or as a medical provider?
Business
both?
owner.
So as a business owner, what contributes to success is grit. You're gonna
Right.
you're gonna encounter a ton of problems.
Mm-hmm.
I solve one problem, 3 more show up. The more problems you show up, the more successful you're gonna be.
Love that.
I mean, that's truly the philosophy to life in general.
Yes, yes. But
So that's
we need to hear that.
that's
Yes.
the success to being to the success of a business. And there's a lot more to it, of course, right? And it takes courage. Business, there's a very funny quote that I love. Being a business owner is like falling off a cliff and then learning how to build a parachute on the way down.
Mm.
There's no, where can I read how to start a concierge medicine practice? Is there a book for it?
Well,
Not
we
really.
watched Netflix.
Royal Pains is all I had.
Yeah.
That's all I had. But they don't teach you about taxes and compliance and HR and hiring people and
No,
training.
You live in the guest house.
So a lot of trial and error. A lot of trial and error, fixing a lot of problems. So that's the key to success to being a good business owner. To being a good medical provider is, I mean, it's as cliche as it sounds, just having the empathy.
Mhm.
And I do think it doesn't feel that way sometimes, but I truly believe that most large, overwhelming number of medical providers are in it to help people. I know that the system is imperfect. I know that we are burned out a lot.
I
know
concur.
that we are frustrated, both patients and doctors,
Mhm.
and we are kind of taking it out on one another. The patient is waiting for 2 hours in the lobby, and the doctor is pissed off that he's got 20 people
Right.
waiting in
The
the
patient
lobby.
suffering, the doctor suffering, everyone's
Yep.
tug of war.
Yep. And then we take it out on one another. So, but I truly believe that a large, overwhelming number of medical providers started off in the medical field because we want to help people. And I think as long as we keep that in the back of our minds while we're in the field and, fight the system instead of like getting steamrolled.
Right.
I got tired of working with insurances and I said, I'm not going to accept insurances.
Mm-hmm.
I'm going to start a clinic that I can negotiate with the patient directly what they think is a fair price for my services. And that's how you end up where we are.
I think that's a great policy. And I believe a lot of concierge medicine doctors are doing that, or practices are doing that.
It's growing. It's growing in
Mhm.
popularity. A large part is because we are being abused.
Mhm.
And medical providers are being abused by the system, whether it's health insurances, administrators. I think there's a crazy statistic that there's 10 administrators for every doctor now in the healthcare
Oh,
industry.
my goodness.
That's insane because our way of fixing problems is by increasing the complexity instead of cutting it down.
Right. They add more layers
Yeah.
instead.
And then we need more administrators to fix the problems that were created. And those administrators then create more problems that need new administrators to fix.
So they need more AI,
I think so.
more people to just navigate the AI.
Yeah,
More
because
people to navigate the AI.
AI is unbiased.
Mm-hmm.
The AI doesn't care about giving you the wrong information because it's afraid of losing its job.
Mm-hmm.
How does that happen? I would imagine probably to some degree, right?
Of course.
People
Everyone's
make-
looking over their shoulder.
People make their job much more important than it could potentially be because they like to keep their job and pay their families. We don't blame them,
Yes.
but it does exist, right? So AI is unbiased.
Ulterior
and it'll-
motives.
and it'll
yes.
cut and it'll just give you facts. So
Mhm.
you decide to do what you want with that information.
That's the world we live in.
Yeah,
yes.
I think unbiased answers are very important, and AI is probably the closest thing we're going to get to,
Especially in medical.
especially medical.
Yes, that's what we need.
Especially medical.
Yeah.
Yeah. I think it's very fascinating. Also, one of the most rapidly changed in healthcare specialty is probably radiology, like diagnostic radiology,
How so?
because you can upload a picture of an X-ray to AI and it'll tell you what's wrong with you.
So what?
And that's the whole job.
A
the
long
whole
time
career
ago,
of a
it used to
doctor.
go to India. Now, where does right?
Now it goes to the cloud.
now, now it goes to the cloud. But now, do you see it right away? Do you have a certain center where you send people? How does that work?
So
In your
by the way,
practice?
in our practice, we do mobile X-rays, EKGs, ultrasounds, etc. Labs. We send a tech to your home with an X-ray.
Oh, you
machine,
do?
portable X-rays. They'll take a
Okay.
picture in your bed and then they'll upload it online instantaneously. And then the radiology will read it within a few minutes and it'll give me an answer within another few minutes after that.
Do you call the patient?
To give them the
And go,
results.
yes.
Yeah. Sometimes I'm still there by the time I get an answer.
That's amazing.
Yeah. Technology. I mean, I think it's very fascinating. I don't know why people are afraid of technology.
It's not anything to be afraid of, but you have to
it's
be
just-
knowledgeable and embrace it.
Yeah, exactly. It's just, human nature, we're always afraid of change.
That is true.
And most successful people learn how to embrace change and they learn how to use it to their advantage
Mm-hmm.
more than anything.
Precisely.
Yeah, it's very cool.
Well, thank you very much for sharing your insights
Yeah.
and all the ways that you have personally embraced it and some changes that you want to
See the world embrace as well.
see the world embrace
Yeah,
as well.
I encourage people, when people tell me that they're afraid of AI, I kind of butt in and say, you don't have to be.
No.
Honestly, I think, look at all the cool ways that I'm using AI to assist me.
Yes.
And, I think maybe they see the light in it, but I think it just takes time, just like anything else.
Takes
It
time.
takes
Sometimes it takes 7 times you have to see something or try something until you master it.
Sounds about right.
Yeah.
We could ask AI.
Repetition.
Yeah.
Repetition.
Dip your toes, and then you see how it does.
Exactly.
But I think, I think universities, I imagine pretty soon will probably start having courses on how to use AI. Remember when we were, in grade school, that they were teaching us how to type on the computer?
Oh yeah, with my hands under the paper.
So I imagine some form of that will probably come up soon.
That should start in school,
Mm-hmm.
in grade school.
Yeah. I don't know how teachers figuring out how students are coming up with their own essay versus AI generated essays, for example, like their own homeworks.
Well, they run it through. They don't write anymore, I don't think.
Yeah.
They just
they
type.
use AI to detect AI.
Yes.
I know, but it just seems like there's probably easy ways around it.
I'm sure there always are
Right.
ways to break a code.
Yeah.
What's the saying?
So that worries me a tiny bit, then because we might be losing our creativity
Creativity, brain power,
because we have,
writing skills.
because we have AI do the thinking for us.
For sure.
I think that probably comes with the idea of teaching your child to learn to love education rather than seeing it as a task.
I love education.
I know you do. You have how many degrees now?
Going on my third.
Good for you. What's the next one?
No, this is going to be my third.
Okay.
I have my BS, my MBA, and this is my ALM data science.
Okay. Or do you have any plans after that?
We don't know. To be continued.
It's very exciting. I'm very happy for you.
Thank you.
I'm happy that you did this. I think when you called me and you asked me to do this, I was very excited because I think it's a very cool topic. I mean, we're in the brink of history, and we're in the infancy of AI. Think about where it will be just 5 years from now.
Exactly.
It's very exciting time.
That's what I've found. We need a bridge because now that I'm in data science, I find a lot of people are scared. They don't understand how to use artificial intelligence. They don't know where it's going, where their life is going,
how to access it,
how to
use the right prompts.
I can't find a job because of AI. And then in school, everyone, is gung-ho about it, but they're, just typing on the computer and they just want to, sit in a cubicle type of thing. So I want to bridge and really just inform.
I think, one of the exciting things that I learned about AI was in the beginning when it first came out, because with like Google, you want to kind of keep your search query simple to get the better results. With AI, it's the opposite. The more information you feed it, you don't have to be afraid of confusing it. The more information you feed it, the better the results you're going to get.
That's such a great point. Yeah. When we started with Google, they had us do like quotes, for the main words.
2 words. And then the plus sign in the between.
Yes.
Yeah. iCare plus concierge medicine. You have to like put those words together.
That's right.
Now with AI, it's the opposite. Just data dump all your thoughts. Here's what I'm thinking. Here's my level of education. Here's what I want to do. And just it does all. And the more information you give it, the better the results.
That's right.
And it's pretty cool.
It saves your preferences. Yes.
Yeah. I've had to do that where I've asked it a question and it says, Ivan, this is kind of pretty brilliant for the type of business that you have because this and this. I'm like, it's not even something I asked it, but it has saved that into its database about the user and what I do. And also, by the way, because I've tested this too, like when my wife asks it a medical question, a lot of times it'll say, consult with a medical doctor. For me, it'll give me the right answer because it knows that I'm a medical provider.
That's amazing. Yeah. I love that.
It's no surprise. Yeah.
Turn to your left.
Yeah. Well, thank you for having me, Julie. This was awesome.
Thank you, Ivan.
Wish you all the best.
It was a pleasure speaking with you, and I think we all have more information, and we all feel comfortable now.
Yeah. If you need us, you can call us at 305-701-9901 or just icaremm.com. Thank you, guys.
Thank you. And remember, at JuliexAI, the future belongs to those who understand it.
Well, Julie, thank you so much for having me. This was such a wonderful chat. I like what you're doing. I like that you're bringing insight to the topic. It's such a hot topic right now, of course. So, to our guest listeners, if you like this, please press like and subscribe. And if you enjoy this content, let's continue the conversation in the comment section. Thank you again.
You're welcome. Please click subscribe and share to your friends and family. Have a great day. Guess what? iCare Mobile Medicine is giving JuliexAI listeners $50 off any house or hotel call visit. Use promo code JuliexAI when you book. Skip the waiting room and let healthcare come to you.
JuliexAI.